Good afternoon, everyone. My name is Nirav Shah. I'm the director of Maine's Center for Disease Control and Prevention. Delighted to join everyone this afternoon to provide everyone an update on where things stand with respect to COVID-19 across the state of Maine for today, Tuesday, October 13th, 2020. Overall, across the state, there are a total of 5,780 cases of COVID-19, an increase of 28 new cases since yesterday. Of those, 5,160 are confirmed cases, an increase of 16, and 620 are probable cases, an increase of 12. Cumulatively, 463 individuals have been hospitalized, and right now in Maine, 8 individuals are currently in the hospital with COVID-19, 3 of whom are in the ICU, and none of whom is on a ventilator. In the past 30 days, 28 individuals have been hospitalized. 143 have passed away, the same number as it was, and just over 5,000, 5,006 to be exact, have recovered, an increase of 8 recoveries since yesterday. Among our 5,780 cases are 1,085 healthcare workers. Just to provide a bit of insight and flavor as to where the new cases are being diagnosed, of the new cases reported today, approximately 20% each come from Cumberland, Somerset, and York counties. Again, about 20% coming from each of those counties, respectively. And then about 12% of the new cases come from Kennebec County, and the remaining cases come from elsewhere across the state. Turning to some of the outbreaks in which Maine CDC is engaged, let's first start with some newer outbreak investigations that we've opened. One is at the Coastal Ridge Elementary School in York, where there are a total of 4 cases, 3 of which are confirmed cases, 1 of which is a probable case. We're working very closely with school officials there to understand who has been affected, who the close contacts are, and arrange for any other interventions that may be necessary. The second investigation we've recently opened is that associated with first responders who are working with the United States Veterans Administration healthcare system. There are a total of 4 cases in and around specifically the Togus site. Our initial investigation suggests that the primary connecting point for these 4 cases is the Togus campus, but we're casting a broader net to determine whether there are other cases potentially associated with the VA healthcare system at this time. And then finally, at the LL Bean Distribution Center, a total of 5 cases. I'd like to stress that this is at the Distribution and Fulfillment Center, not part of the normal customer-facing operations. Similarly, as with all workplace outbreaks, we're working with our colleagues at Bean to try to get a better sense of whether the workplace was the site of transmission or whether it happened to be the place in which community transmission just happened to be detected. As we learn more about the investigation, we'll have further updates. Next, an update on some of the ongoing outbreak investigations in which Maine CDC is engaged. At the Community Regional Charter School in Cornville, there are now a total of 17 cases associated with that school. At the Kids Count facility in Augusta, the Child Care Center in Augusta, there are a total of 4 cases. At ND Paper, in and around the Rumford area, there are a total of 24 cases. At Woodland Pulp in the Baileyville area, a total of 19 cases. And at the Meadows, an independent living facility in Greene, we are aware right now of a total of 15 cases. That facility recently offered universal testing and 19 individuals were tested there. Of those 19, there were an additional 8 cases that were found to be positive, again, bringing the total number to now 15 cases. Finally, last week, I mentioned an exposure, a series of exposures that could have potentially occurred associated with 8 hockey games that were played on October 3rd and October 4th, where one of the refs who was on the ice at that time tested positive for COVID-19. As we discussed, there were potentially up to 400 people who have been exposed. Maine CDC is keeping a very keen eye out for any cases that could potentially be connected to any of those exposures. We are now at this point 9 or 10 days out from those potential exposures. So again, we're keeping our eyes open for the possibility that that any new cases that we detect could have been a result of any of those exposures. At this time, we haven't detected any, but we are just now going into the window in which those cases may occur. If we detect any such subsequent exposures, we'll make sure to keep everyone updated on that. Next, an update on some of our testing activities. Right now in Maine, our 7-day positivity rate stands at 0.46%, and our testing volume stands at 472 PCR tests that are being conducted for every 100,000 people. I pause on those numbers for just a moment to take a bit of a step back and just note some recent markers that we have passed on our collective COVID-19 journey. First, at some point today, we reached or surpassed over 5,000 individuals who have been recovered from COVID-19. Right now, again, the number stands at 5,006. So at some point just in the past 24 hours, we surpassed the 5,000 threshold. The testing volume number that I just mentioned, 472 for every 100,000 people, also represents a high mark for us, yet another marker that we've passed on our collective COVID-19 journey. The other marker I wanted to mention is that at some point, again, in the not too recent past, we surpassed 500,000 PCR tests, 500,000 tests that have been reported to Maine CDC for COVID-19. To be precise, the exact number is 513,658 PCR tests that have been reported to Maine CDC at this point. I just wanted to pause on those numbers for a moment to give us all an opportunity to take a step back and take stock in terms of where we are with respect to COVID-19. The risks of COVID-19 still continue to this day. We're starting to see transmission occurring in parts of the state where previously the number of new cases has been low. To be sure, as we've discussed, some of that is related to expanded testing. As I mentioned, we've hit a high mark there, but not potentially all of it. We've simultaneously seen new transmission events that have also occurred in those parts of the state. I say all this because as we go into the winter, the possibility that there could be greater levels of transmission is one that we are greatly concerned about. What we're also concerned about is just not the geographic distribution and dimensions of those transmissions, but the nature of where they are occurring. Up until now, much of our focus on COVID-19 as a state, as a country, has been on public areas where interaction with others are quite possible, on the street, so we're all wearing masks, in places like that, where we could be encountering others who, unbeknownst to us, might have COVID-19. But as we go into the winter and the colder months, and more activity occurs indoors, in and around people that we know, we have to now be equally concerned, not so much about public spaces, but private spaces. This is a pattern that, according to some epidemiologists, has generated much of the transmission that we've seen in other parts of the country, in the Great Plains states, the upper Midwest, for example, the Dakotas, Iowa, Wisconsin. According to some epidemiologists, a large reason for the upticks in cases there is because, again, not of public space transmission, but private space transmission. I'm asking everyone to be on the lookout for that phenomenon here in Maine and to take steps to reduce it from happening. One of the first things that everyone can do in general to stay healthy is to go get your flu shot. We're all preparing for the winter months. For some of us, for many of us, that means taking steps to winterize everything around us, winterizing our car, winterizing our houses, winterizing our wardrobe. What I'm asking everyone to do today is not just winterize, but also immunize. We can do both at the same time. As you're doing things to prepare for the winter, for your home, for your car, for your clothing to keep you warm, I also ask that you winterize and immunize as well. This just doesn't stop with the flu shot, however. One of the unfortunate consequences of COVID-19 is that immunization rates, sadly, across the country have come down. Maine has not been an exception to that. We've particularly seen immunization rates that have fallen in and among adolescent populations. So for parents out there, before it gets too cold, this is a great time, a perfect opportunity to call your kids' healthcare providers and make sure that they have got their well child checkup, and particularly to make sure that they are up to date on all of their immunizations as we go into the colder months. But even there, it's not limited to adolescents and children. Adults have a vaccine schedule themselves. Many of us seem to have forgotten, I myself forget that vaccines are just as important for adults as they can be for kids and adolescents. So for all of the adults who are watching right now, please reach out to your healthcare provider to make sure that you are up to date on your own adult immunizations. Depending on what age group you fall into, that can include making sure you've gotten your pneumonia vaccine, your shingles vaccine, and a number of other vaccines that are specifically geared toward adult populations. As we go into the colder months, one of the things that everyone who has been so kind to welcome me to Maine has emphasized to me is that you gotta find something to do in the cold months. Otherwise, being indoors is just too much to take. That's why we've started in my own family the process of getting ready for the winter. But I'm asking everyone today, as you winterize, please also immunize as well. So with that, I'm going to turn things over to our colleagues in the media. And the first question today goes to Patrick Whittle.
Thank you very much. Speaking of winter, the new there are some tweaks to the rules regarding things like indoor gatherings and mask use indoors that I believe go into effect today. If you could touch base on those, that would be great. And also, I'd like to know if you think it's fair to describe these as sort of a relaxation of the rules, because they seem to me to sort of loosen the restrictions somewhat at a time when we're going into colder weather and more indoor gatherings. And I would like to know sort of what the thought process is there from the state.
Sure, Patrick. I think it's a bit of both. I think in some respects it is a loosening, but in other respects it's asking folks to be more concerned. And I don't think the two are in conflict with one another. So on one hand, for example, the indoor gathering limit has been increased, depending on the type of situation. That's in recognition of the fact that there are, as we go into colder months, there may be more folks indoors. And it's also a recognition of the fact that folks are wanting to resume other types of social activity. So on one hand, we have moved in the direction that we've seen other states go to, even some of the states in the Northeast. But at the same time, we've liberalized our approach there. We've also tightened the approach with respect to things like the parts of the state in which the mask mandate is in force. Earlier in the summer, the focus on mask wearing was in the highly touristed areas along the coast and in areas where we knew to be a higher number of folks who would cause more foot traffic. But as we go into the colder months, as we've seen transmission occurring in other parts of the state, Governor Mills felt it essential to expand the use of mask wearing across the state, not just in the highly touristed areas. So Patrick, I think I would think of it, or I think of it as a bit of both. On one hand, a recognition that folks coming indoors is something that is likely to happen, but coupling it with increased usage of masks across the state, and then on a recommendation guideline as terms of good public health, wearing those masks when folks are indoors so that you can reduce the likelihood of transmission.
Could you talk a bit, sorry to put you on the spot, but could you talk a little bit about what the new areas where people need to wear masks indoors are per the state rules? Because I think This might come as somewhat of a surprise to some folks listening.
Right. So previously over the summer, the areas were largely the coastal counties. Again, areas where we knew that there would be a higher number of tourists and thus a higher population density. Going forward, however, the mandate applies statewide. It also, however, applies in places particularly where we know that there will be higher likelihood of folks gathering. Retail establishments, for example. So it applies to the counties that were previously not included in that discussion, mainly because, again, there we've started to see more cases arise in parts of the state where there had previously been fewer. So Somerset County, Kennebec County, Franklin County. So I think it's in recognition that one, in the summer, it was really more about the higher population density in coastal touristed areas. But now, as those numbers have receded, we're simultaneously seeing more cases in the interior parts of the state. Thus, the two go hand in hand.
Great. Thank you very much for going over all of that.
You bet. I'm going to turn next to Charlie at the BDN.
Yeah. Hi, Dr. Shah. Thank you. What do you think? So if you look at the new daily case counts of COVID in Maine, or rather the 7-day rolling average of new daily case counts since I think like mid-August or so, it's kind of been mostly climbing from about 15 to now over 30. What do you think explains, why do you think that keeps going up the way it has been?
Sure, Charlie. There are a number of factors that all of which taken all together, I think, are contributing to the gradually increasing uptick in average daily new cases. Let me make one observation at the outset, though, Charlie. When you take a look back at those data, one of the things that you don't see is exponential growth, which has happened in states like Florida, now Wisconsin, Texas, Arizona earlier. You saw small increases that then quickly generated significant increases. That has not happened in Maine, and that is a testament to Maine people themselves for helping us all keep a lid on things. As you may recall, this was something that I was deeply concerned about in and around York County, that the few cases could generate exponential growth. Thus far, it has not happened, but to be sure, it could. But what helps explain the more gradual, steadier state increase that we've seen? It's a couple of things. The first is an expansion of testing. Now, I don't know to what extent expanded testing it accounts for this increase. That's an epidemiological question that candidly is something that's much easier to answer after all the data are in. But we've expanded testing both in terms of the availability of it via swab and send sites, as well as the access to it via the standing order, which allows anyone in the state of Maine to have a doctor's order to be tested. That's a part of it. The other part of it, though, Charlie, is greater levels of community transmission. We've seen increasing numbers of individuals on a daily basis who, when the case investigator first reaches out to them, that individual doesn't report any known connection with an open outbreak. That's a sign that transmission is occurring and folks are not quite sure the situation in which they may have contracted the disease from. Those are, I think, the two principal reasons why we've seen a slow increase in cases. This increase can be, we can stop it. There are ways that we can put the brakes on it. The other data that we have right now suggests that one of the finest ways, especially as we go into the colder months, is more widespread mask use. States, territories, countries around the world that have increased their mask usage saw a corresponding decrease in the number of new cases. It really stresses the importance of mask wearing right now.
And then just generally, do you have a sense whether the number of COVID outbreaks in Maine, just not the size of each one, but the total number, it has kind of, stayed level, or has it ticked up recently in Maine, just, throughout the pandemic?
Charlie, I have a list, and I don't want to do eyeball math and get it wrong. So I don't want to mischaracterize it. We've still continued to open outbreaks at a pretty steady clip. Some weeks there are more, other weeks there are fewer. But to be candid with you, Charlie, you ask an empirical question, and I don't want to give you a speculation or a guesstimate. I'll see if we can characterize it with better numbers for you, so I'm just not making eyeball judgments. But we have continued to see new outbreaks. We continue to detect new outbreaks, and where possible, we continue to piece them together. That process hasn't abated one bit. Whether it's with more intensity than it was before, that's a good empirical question. And again, I don't want to give you an estimate that might actually be mathematically not right.
Sure. Okay. Thank you.
You bet. I'm going to turn next to Amy Brown at WERU.
Thank you, Dr. Shah. Can you explain again the criteria that the Maine CDC uses to determine when a person is considered recovered, what that's based on, and give us your take on the president being released from quarantine so quickly?
Sure, Amy. So we utilize to a T the US CDC's guidelines for what constitutes somebody who can be deemed to be recovered. There are two pathways through which somebody could find themselves in the recovered box. The majority, the one that the US CDC recommends, is a symptom-based approach. That is to say, someone has to be symptom-free for a certain period of days after they have first started experiencing symptoms. Generally speaking, that takes approximately 10 days. However, if someone continues to experience symptoms, that process can take longer. Generally speaking, again, we look for 72 hours where no one has experienced symptoms without taking any medication that would mask their symptoms before they are moved into the recovered box. They also have to have gone at least 7 days after their first onset of symptoms before they can even be considered for that 72-hour window. It gets kind of head turning when you start working your way through the algorithm. So that is an extreme simplification. The algorithm is on the US CDC's website. It's there for everyone to read through. But again, it has a lot of twists and turns. What I've just provided is a quick summary of it. The other pathway is that someone can be tested twice and be negative. That pathway is really reserved for individuals who have health conditions for which the symptom-based method may not be appropriate. The majority of individuals move into the recovered box through the symptom-based method, not the testing method. With respect to the president's moves there, I would refer any questions about any of the judgments around President Trump's health status to his doctors. He's not someone who's under Maine CDC's monitoring or purview, so I can't comment on him.
Just to follow up on that before my second question, though, would something like a methylprednisone, if I'm pronouncing that correctly, mask symptoms even for a period of time after the person had tapered off it?
Prednisone can tamp down on the severity of symptoms in some patients, not in all patients. It really does depend on the dose. there are multiple different forms of corticosteroids. Prednisone is one, methylprednisone is another, dexamethasone is yet a third. They all vary by their intensity and their duration of, and how long they last, their duration of effect. And depending on the dose and depending on which steroid was selected by the healthcare provider, they can have varying degrees. It's really not a one size fits all approach there. There are quite a few different steroids that are out there.
Okay, thank you. My next question is about vaccine trials.
Mhm.
If you're watching those, what's looking promising?
We watch those very, very carefully. And I make sure as part of my work, I make sure that I attend each and every one of the briefings that the US CDC convenes for state health officials like myself to make sure that I'm staying up to date on the latest vaccines. In terms of what looks promising, Amy, there it really is way too early and frankly, impossible to speculate. The data won't really be released until the manufacturers and the FDA have gone through all of the regulatory steps that they need to do to release the data. Right now, it's only a very select number of scientists who are independent of the vaccine manufacturers who review those data on an ongoing basis as part of what's called the Data Safety Monitoring Board. We get updates on those as they see fit to release them. But right now, based on where the trials are, it's too early to speculate about which ones may look promising, because as with any trial, the data aren't in until all the data are in.
Thank you.
I'm going to turn now to Bob Evans at News Center.
Good afternoon, Dr. Shah. There's no question the health of the Maine economy needs to be considered, but how do you feel about us relaxing indoor dining and soon drinking establishment restrictions at the very same time our numbers are increasing and spreading in communities that didn't have significant transmissions earlier?
Yep. Bob, this has been something that's been on my mind, thinking about this from the public health perspective. And you know what I kind of make sure I keep in mind as we're having these discussions, and I'm discussing it with my team, is that the experience of being in a restaurant or at the point in which bars reopen, what that looks like when those establishments reopen will be much different from the way that it looked before the pandemic. Seating will be absolutely required. There will be no milling about. There's going to be much more widespread use of plexiglass. Tables will be further apart. So these, as folks call them, engineering controls, mean that the experience of being in a restaurant or a bar will be different from a visual perspective than from what it was previously. That's an important consideration and one that I try to keep in mind as we're thinking about what the system will look like. The other thing to keep in mind about this, Bob, and this is related to Patrick's question as well about some of the changes. For certain establishments, because we are starting to move to a percentage of total capacity system, there are some establishments where the number of people who may be inside them may be lower than what it was before. This is, again, all designed to introduce as much space as possible between folks. Our goal is to try to have these important economic and social activities, like sharing a meal with somebody. Our goal is to try to have them restart in ways that preserve safety. We've learned a lot from the experience of other states, both positive and negative, that have moved toward expanded indoor capacity limits. And we've been able to put into place, working with our checklist group, rules, recommendations for establishments to abide by as they are moving toward reopening. And I think that's why, as I think about this, it's why I go back to what I started with. Things will look much different from the way they did because of these engineering controls that are designed to reduce the transmission risk, but simultaneously allow people to go back and make sure that they're socializing.
Okay. While we are relaxing these restrictions, some parents want to know why they can't gather at hockey rinks.
Well, Bob, one note, there, again, consistent with what I mentioned to Patrick, some of the restrictions are being loosened, others are being tightened, like with respect to, say, mask wearing. So it is a bit of both. Those are not inconsistent with one another. We're recognizing that folks should be out there, people want to be out there. We're just making sure that this is the vehicle through which they can do so safely. I know that there's a lot of concern around some of these public health requirements. In my own mind, I do not view them as I don't view these requirements like increased mask wearing as an obstacle, just the opposite. Rather than being an obstacle, they are in fact the vehicle through which we can resume more economic and social activity. Now, with respect to things like gatherings, even there, the outdoor gathering limit remains at 100 people. So individuals can gather in those spaces, but we've seen time and time again that even outdoor gatherings pose a risk of transmission. That's why even when you're in an outdoor space, let alone an indoor space, maintaining as much physical distance as possible between families or even within families is one of the surest ways to reduce transmission.
Thank you.
I'm going to turn now to Patty White at Maine Public.
Thanks, Dr. Shah. You said a couple weeks ago that Maine was going to get about 26,000 rapid antigen tests as part of a federal allocation. Have we received those tests yet, and have you decided how they'll be used?
We recently did receive the first allocation of approximately 26,000. What we're working on right now, Patty, is a phased approach to distributing those. Phase one will, and here, let me go back. These are the principles that we are keeping in mind as we look to where we will distribute them. The first is making sure they are used as is epidemiologically appropriate. I'll go back into that in a minute. The second is that the test, even though it is small and portable, still requires the place that is using it to have the appropriate federal certification. It is not an at-home test. It has to be used in a location that has been permitted to use it. The third thing that we're looking at as a general principle is that we still need to make sure we are able to see the data that's generated from that test. If someone tests positive, is the person to whom we have given the test to able to report that to the CDC? What about the negative results? If we don't have the negative results, calculating the positivity rate, one of that all important variable becomes impossible. So those are just some of the considerations, the general principles that we're looking at. In light of those principles, we're working on essentially a three-phase model for distributing these. Phase one will be institutions, entities that can check off all of those general principles. That includes places like shelters for people experiencing homelessness, first responders like EMS facilities, as well as correctional facilities. The second is, and part of that also will be schools as well, but we're working with the schools to make sure they've got the regulatory certification in place. The second phase will be other facilities that can also utilize these tests, but for facilities that may need a little bit more time, for example, to get the reporting system in place. And then similarly with the third phase, places that can make use of the test for good public health benefits, but who might need even a little bit more time to make sure that they can get the regulatory certification, the training, and the reporting pieces ready to go. So we're working on that. We're hoping to have the first tranche of tests distributed very soon.
And do you know how many more tests we're supposed to receive as part of the federal allocation? And also, are you looking for other sources? Are you seeing these rapid tests as something we really need to expand on as part of our strategy to, contain that the coronavirus?
Patty, we have been informed by the federal government that Maine will receive approximately 400,000 of these tests through the end of the year. So it's roughly 26,000 per week going forward. We've only received the first shipment thus far, and even that was just a matter of days ago. We don't know what the distribution plan will be after January 1st. We've asked, and we haven't gotten an answer as to what happens come January 1st. More generally, with respect to rapid testing certainly has its place. But what we've seen with some of the rapid tests that have come to market thus far, the earlier one by Abbott and then this newer one by Abbott, is that one of the keys to using them will be in settings where individuals can be potentially retested on a number of occasions, so-called serial testing. One-off testing with these rapid tests raises some epidemiological questions because the test is not at the same level as the gold standard test that's done at the Maine CDC laboratory. There's room at the table for all of these different methodologies, so we're not shutting any of them out. The question for us is, what are the appropriate use cases for these tests, and what must they be coupled with to confirm the initial result that we get, so we're not accidentally giving people false positive or false negative results. So it's not a question of which tests, it's a question of how we use all of the new tests that are coming to market in the right use case and in the right use setting.
Thanks.
I'm going to turn to Evan Popp next.
Hi, Dr. Shah, thank you. So following up on some of the questions about stage 4 reopening. So it seems like from your answers, both economic and public health factors are at play in that decision. And so I'm wondering if the decision was purely on a public health basis, would you recommend the same reopening action be taken?
Evan, that's, ultimately the governor is the one who is the decider on those issues. What I will tell you is that my advice and the recommendations that I and the Maine CDC have made are made solely with public health considerations in mind. Public health being not just infectious disease, but also mental health and other concerns. That's the purview that we look at all of these decisions from. It's ultimately Governor Mills and her team to their purview to balance all of those. The recommendations that we make are solely focused on public health, but recognizing that public health in the middle of a pandemic takes many different forms. There's the immediate concern around infectious disease, but we also have to balance that with very real concerns about social isolation, loneliness, and the impact that that can have on folks across the state, particularly, for example, in places like nursing facilities.
Great. And then I was also wondering, it was noted in the announcement about the stage 4 reopening that chambers of commerce were consulted on that decision. Are you aware of any kind of frontline workers or the representatives who were also brought into that process?
It's possible. I think that would be a better question that the governor's office or DECD would have more insight into.
Great, thank you.
You bet. I'm going to turn now to Brian Sullivan at WABI.
Thank you, Dr. Shah. I have a note from a viewer here about a positive case at a local college. This grandmother wrote in and said that her granddaughter was deemed a close contact in the case, and it took your contact tracers or the CDC's contact tracers about a week or more to get in touch with her. And then there was some confusion about what she should do. They said she should quarantine, but she could still return to work. So I guess my question would be that as you've seen this steady rise in cases across the state, how are your contact tracers doing, and are they feeling the burden of these additional cases here in the state?
Yep, Brian, again, I can't comment on individual cases without knowing all the specifics. Close contacts are treated differently from confirmed cases. So there are certainly nuances in the way in which confirmed cases, probable cases, and close contacts are given advice from a public health perspective. I can't comment on individual cases because it really is highly fact specific. But to the broader question you raised, we continue to have approximately 100 case investigators and contact tracers that are working on making sure that folks who have tested positive have all the advice and support they need, as well as the close contacts that they identify to us. One thing to bear in mind is that Maine CDC can only reach somebody as a close contact after the confirmed case has given us their name. And one of the things that we've seen on numerous occasions is that the very first time a Maine CDC case investigator reaches out to somebody, they may not remember every single person that they've interacted with in the prior 16 days. I don't know about you, but if you ask me on the spot to think and remember the names and phone numbers of every single person I came within 6 feet of for a cumulative 15 minutes over the past 16 days, I don't think I'd be able to get every single name to you that first time. And so what's happened on numerous occasions is people remember, oh, you know what? It turns out that I did see my neighbor Joe and talk to him for 20 minutes 12 days ago. And so that's something we've seen repeatedly. That's okay. That's not a problem. We reach out to people after their name is given to us, no matter when that is. But we have started planning for the potential for having more cases in Maine, and thus making sure we need to have the appropriate number of case investigators and contact tracers on our staff. So we've been looking to expand our contact tracing force to make sure that if the spikes that have occurred in Wisconsin, North Dakota, Wyoming, if that were to happen in Maine, we would be ready and not have to overstretch the team that we've got in place right now. So we're working actively on building that out right now so that in the event those case numbers start to spike, we'll be ready for it.
That move that you just mentioned, that's in reaction to what's happened across the nation, not what's happening here in Maine. That was already something you had planned to do.
Yep, it's really, you know, kind of the bedrock principle of preparation. It's something that we've talked about in these briefings, Brian, which is that when you see something going on the horizon, that's the time to start preparing for it. Because even though everything you do before that difficult situation arises will be considered to be premature, what we also know is that everything you do after that situation arises is too late. So we see what's going on the horizon. We're making sure that if that were to come to the Northeast, specifically to Maine, we'll be ready to flip that switch to turn up the dial even more to make sure we've got the appropriate number of case investigators and contact tracers ready to go if that were to materialize.
And just real quick, if you could give us a little more information about the outbreak at Togus, I think you said they were first responders that were affiliated with it. Just any information more than what you gave that you could provide about what's going on at Togus.
Yep, sure, Brian. So right now, and again, that investigation is in the very early stages. We're aware of 4 cases associated principally with the fire department that served the fire department EMS station that serves the Togus VA. We have also received a report that one of the individuals may also work at another fire department EMS as well. So we're investigating that to see whether there may have been exposures elsewhere. We're also working with them to make sure that they've got all the supports that they need in terms of PPE and testing. Given the somewhat different nature of this facility being on federal property, being run and operated by the United States Department of Veterans Affairs, it's a little bit different in that respect because they're not directly under the regulatory purview of the state. But from a public health perspective, we're here to help. And so we've reached out to them. We've had productive phone calls, and we're now starting the process of trying to understand whether there was ongoing transmission elsewhere.
Thank you.
I'm going to turn now to Allison Ross at WMTW.
Hi, Dr. Shah. Thanks so much for taking my question today. So this is something that you've addressed in the past, and you did discuss it earlier in today's presser. But as we are seeing these strengthened mask mandates today, there is an anti-mask rally here in Maine. We've also seen these happening across the country. So my question today is just what would you say to that group of people who are refusing to wear a mask?
Well, Allison, I've been made aware by one of the members of my team of such a demonstration. I commend them for staging a demonstration around masks by themselves wearing masks, which is in and of itself a good way to go about that. I think with respect to any concerns of any large gathering, my recommendation, my ask is, as with every large gathering, please make sure when you're out there to distance where possible, and as always, take care of yourself and stay healthy out there. It's a cold, chilly day. Please make sure you're bundled up.
Thanks.
Mm-hmm. I'm going to turn next to Dave at WGME.
Hey, good afternoon, Dr. Shah. I hope you're doing well. Got a couple questions for you today. You kind of alluded to this earlier at the outset. Last week, as you know, a hockey referee informed the CDC that he tested positive for COVID. Since then, the Maine Amateur Hockey Association has shut things down. Have you received any more positive COVID-19 tests resulting from this particular situation?
Dave, at this time, we have not. However, major caveat, we are just now entering the time period at which anyone who may have been exposed on October 3rd or 4th would have developed enough virus and potentially be able to be tested positive. So we're keeping a lookout for any possible cases that may have occurred as a result of this exposure. But to be candid with you, Dave, my main focus here is just making sure that people have the information that we've got. To me, that's the essence of transparency. We received word from this individual that they had been on the ice for 8 games over October 3rd and October 4th. The risk of any possible transmission, given what we know about hockey, we're not sure. But the responsible thing to do is to make sure we let people know about that. That's why I wanted to make sure we briefed everybody. We hope that there are no cases, but we don't know. It's possible that there will be, and that those cases will be eventually be traced to the games on October 3rd or October 4th. We just want to make sure that we are providing the information that we need for parents, kids, and families out there to take steps to stay safe. We are keeping our eyes out for any potential cases, given that we're entering the time period at which those may happen. That's where our operation is focused right now. But when we learned about this Thursday, late morning, early afternoon, my job number one, was to make sure I was being fully transparent with everybody so that everyone out there knew what I knew as soon after we had confirmed it.
Dr. Shah, let me ask you, and I guess this is the great unknown, but is there a marker where it'll be safe for the kids to return to the ice? I mean, is there a date in mind that you have, a soft date maybe?
It's difficult to say, Dave, because it really does depend on whether there are cases that are associated with this. If there do turn out to be cases associated with this event, those individuals will have to be in isolation, and everybody that they were in contact with would have to be in quarantine. So it gets into some twists and turns. We don't have a date on the calendar right now, Dave. We're looking at the data. That's what's going to drive any type of decision on this, not the date per se.
Gotcha.
But again, I just want to reiterate this. Our MO in these situations is out of an abundance of caution, as well as a desire to be as transparent as possible, to let people know what we know after we've confirmed it. We hope that there are no subsequent cases, but if there are, at least folks will be on the lookout for them. Parents, folks who are on the ice will know that what may have previously, just a couple of months ago, been a fever and a cough, because of that potential for exposure, is something that should be evaluated for COVID. To me, that's the right way to do business.
Gotcha. And finally, how did you get to the 400 number? Mm-hmm. Or a potential of 400?
Yep, Dave, I'm glad you asked that. That is the high number. That's the high range of the estimate, given the 8 games and the number of players that could have been there, as well as others who were congregating. That's where that number came from. That is on the high end. But again, out of an abundance of caution, we wanted to share what we knew when we knew it. We hope that the actual number is, of course, smaller than that. But the theoretical high end, given 8 games, 2 teams, and other folks associated with those, that's where we came to the 400. But that is the high end of that.
Awesome. Thank you so much, Dr. Shah.
You bet. And the final question for the afternoon goes to Joe Lawler at the Press Herald.
Yes, hi. Just continuing with a couple questions about the hockey referee situation. So just to clarify, with potentially up to 400 people exposed, does that mean that's how many people have been quarantined, or not necessarily? Can you explain that? Explain that a little bit.
Yep. So, Joe, the answer there is that yes, if given that those 400 up to 400 would be considered to be close contacts, that's the number of individuals that we're recommending stay indoors and get tested, even especially if they have symptoms.
But do you know, are those folks actually in quarantine? Are you aware of that?
We're not aware. So in this situation, because of the large number of exposures, so generally, Joe, when we uncover outbreak scenarios or even discrete cases, we are able to list down to the person and contact them individually. In this setting, because it's what we'd consider to be a mass exposure event, the mechanism through which we first and foremost inform everybody is through public channels like this. We're making sure we're now separately reaching out to folks, but that process takes a little bit longer. That's why as soon as we had confirmed the information on Thursday, we wanted to broadcast it so those individuals who were on the ice for those games at that time could take steps to put themselves into quarantine.
Okay, and a couple more questions. One is there a way to characterize, I know obviously, you know, you're saying this is an exposure and so people should be quarantined, but, you know, is there a way to assess just how risky this was, like in comparison to other activities, like, you know, a big house party with people aren't wearing masks? And I guess where does it fall on the spectrum of risk?
Joe, it's difficult to say. So what I can say is that there are some concerning factors and then there are some protective factors. Let's start with the concerning factors. Any athletic activity, vigorous athletic activity, increases the respiration rate, both of the individual referee as well as those who may have been around the referee. So the referee may be exhaling more potential virus particles, and those around the referee may be inhaling more. That in and of itself increases the risk. On the other side of this, though, there are some protective factors. The total duration of time for all players who may have been in contact with the referee, the total duration of time may not have been 15 minutes. Now, we don't know down to the player level who was actually within 15 minutes and who wasn't. That's why we do the mass notification of this nature. The other, of course, is that given that this is a hockey event, folks had some degree of face, they may have had some degree of face covering on, which does help mitigate the risk. Ultimately, Joe, it's impossible to really characterize this. What I will say is that there were enough sufficient concerning factors in this situation, coupled with the high number of people, that out of an abundance of caution, we felt that the right thing to do here, the right way to do business, was to warn everybody. We don't ultimately know what the risk might be. That will determine after the data are in, but there were a number of these concerning factors that led us to say the right thing to do here is to share with people what we know at this time rather than sit on it.
Okay, and my last question is just about, it seems like in the last few weeks, especially Cumberland County has had very low or, you know, low relative to, you know, earlier in the summer or the late spring. Is there any way to discuss why Cumberland County's numbers have been lower lately?
Joe, I have observed the same thing and have talked about it with our team here. Again, today, for example, approximately 20% of the new cases just for today alone are linked to residents in Cumberland County. As a fraction of their population, that's, you know, that's in line. So it's certainly not outsized. I think there are a few things that may be going on there. One of which is that Cumberland County, having experienced a high number of cases earlier on, I think folks are more aware of that and thus may be more sensitized to the need to make sure they're taking the appropriate steps, be that physical distancing, mask wearing, things like that. At the other side, though, Joe, on the reverse of your question, is that although Cumberland County, their numbers have become more in line, we're starting to see more cases in rural counties that are outsized compared to their population. Kennebec, Somerset come to mind. So it is a bit of both that's occurring right now. The other thing I will note, Joe, is that really to get a better read on trends, taking 1 day's worth of data is challenging. So when we take a look back on this, going back, say, 14 days, we do see that Cumberland is a bit more in line with its population size as a whole. Well, thank you all for those questions. And before we wrap up for the day, just another reminder that now is the perfect time to make sure you've gotten not just your flu shot, but all of your immunizations. We're all getting ready to take steps to winterize now. While you are winterizing, please immunize as well. This is the perfect time to do both so that we go into the colder months ready to go. So with that, thank you all for your time today. As always, please be kind, take care of one another. We'll talk again on Thursday.